We are Healthcare Partners of Nevada. We promise to earn and keep your trust.
We promise to treat you like family.
We promise.
We promise.
We promise to be an important part of the community.
We are Healthcare Partners of Nevada.
We're Healthcare Partners of Nevada.
We are Healthcare Partners of Nevada.
Contact us today to learn more about our promise to patients and to find out how you can see a Healthcare Partners doctor.
The question of screening, who's at risk and who should be screened. So one way to think about it is this way. If a 35-year-old woman shows up with these symptoms, should we be thinking about a heart attack? Should they be thinking about it? The answer is no. Why? Because they're very low risk to have a heart attack. Almost no 35-year-old women ever have heart attacks. Whereas if it's a 75-year-old person, say, who has two family members that died at a young age before 60, who has high cholesterol and is on treatment for that, maybe is diabetic and smokes, that's a high-risk person for heart disease. If they have those symptoms, that has to be taken seriously, and it's a heart symptom until proven otherwise.
Is there a schedule that a person should have of occasionally getting these kinds of screenings?
Well, this is the subject of a lot of discussion, and the criteria for screening testing has been revised in the past year. So routine screening with advanced testing like stress tests no longer recommended because most people have normal tests, and the ones that have abnormal tests usually don't have heart disease anyway. So you have to choose very carefully who gets a screening test. There has to be a high, as we call it, index of suspicion or high risk factor profile before doing screening testing in people who have no symptoms. There's far more to be gained by treating the risk factors than going on a fishing expedition looking for silent disease.